from the patient perspective, from the doctor's perspective, work together. And having some support, institutional support, scientific society that the doctors support, patient groups that the patients support, and working together has been extremely, extremely fruitful over the past few years in the hepatitis field.
For the country like Russia, it will help in terms of improve access to treatment. It is a problem for doctors, the bad access to treatment is a real problem, because we're trying to explain the patients that they need treatment, but when they ask how much is that, and in Russia, unfortunately, it's now almost all the treatment is out of pocket. It is pretty difficult to see the reaction of the patients, because for some patients it's absolutely unaffordable to pay for the whole course of treatment. It could be very expensive, and when the patients influence the situation in terms of improving accessibility to treatment, improving maybe organizing of reimbursement program. Of course, it helps doctors to be more professional, I would say, even to be able to provide better treatment to the patient's society.
I think one of the main things that we actually have to look at the approach to the viral hepatitis response is actually having the relevant stakeholders. So the clinicians or the hepatologists and other stakeholders who can play a role in actually changing or responding to the viral hepatitis strategy can actually work together.
The responsibility to address a disease gets shared between three constituencies: the patients themselves who live through the disease, doctors who provide for that care, and those that then enable the doctors to do their job by providing them with the tools to do so, i.e. the pharma companies or the medical devices companies or the diagnostic companies. It's these three constituencies that come together, and all three are equally effective in addressing governments too. And so when either financing is not available or a set of products are not available, or when things are not working, particularly for the physicians who need to make sure that there is a certain standard of care to be delivered, patients can act independently, speak up either to the producers and manufacturers of devices and products, therapeutics, or to governments to say something is not happening, something is not being provided for. And so therefore they become an independent voice, independent of the clinicians, because there's a limitation to how much clinicians can then push back on either the governments or to the companies that provide them with the tools to do their clinical work. So what I see is this three-way partnership. All three need to work. Patients can and should be talking to clinicians. Patients can and should also be talking to the producers of therapeutics and devices as to what works for them, the limitations of the current range of products, and spurring them on to getting better products that are more safe and more beneficial for their disease outcomes.
The benefit will be that the doctor can help and support the patients more strongly and can give the treatment to a larger number of patients more easily. When the patients are supported by the government, when they are supported by the community, this of course will make the treatment more available, more easy access. All the right informations are there, so this is of course will be very convenient to the doctors.
The patient groups are a voice for the people living with viral hepatitis, and that can be quite powerful and can be leveraged actually to lobby policymakers to drive change, and more importantly to have viral hepatitis in the policy agenda. I think to have a coordinated response to viral hepatitis at the country level certainly will involve a policy change, and patient groups can certainly be the best one of the ways where you can lobby change using the policymakers.